Mr. Lee, kindergarten teacher?
Yeah.
Sick. So, former tennis player, plays pickleball now, plays some golf. He has some issues in the wrist he was talking about. We'll poke around with that, but usually it's a little bit of an instability thing. And that could be coming from the neck and the shoulder. He played a little baseball too. Pretty active. I felt in his front neck right away. So all that's related. All the nerves that supply the arm come through here. So we'll just clear all this out first. He's never been adjusted either. So first time.
Oh, I also play drums, which is probably
Okay.
why I have like an ostrich neck. Yeah.
You wish. I see way worse.
Oh, really?
Yeah. But yeah, it doesn't help.
Mm-hmm.
All you can do is try to keep your chin back whenever you can.
Mm-hmm.
The farther your chin is forward, the more pressure it puts on the back of the neck. So are there any like movements that you'll be like, oh yeah, I can feel it there?
If I go right to left.
So like right now, you can feel that?
Yeah. So
Okay.
here it's like okay, and then this is like the furthest I can go.
Okay, try it again. Is it better?
A little bit.
Yeah. So basically, I created stability at these bones and the pain went away. That means a little bit instability in the elbow. We would probably diagnose this as tennis elbow. Makes sense, right? But if it's bothering you and you're about to go play for a couple hours, there's a brace that comes, it literally just, you just strap it on right here and it just does this. So literally pain completely gone the whole time. It's not the best thing in the world to use all the time, just when you're playing. And you'll see professional athletes with braces on when they play all the time. But they take it off immediately after. You don't want to like get your arm used to that, because then daily things will start to be hard. Probably like twisting off like bottles and stuff.
Yeah.
So we'll just work up this chain a little bit. Then probably get into the rotator cuff muscles. On his tricep here.
Oh.
And then we'll get the bicep. So rehab type stuff would be gripping really hard on a weight and then having it, like holding it in a certain plane. Or gripping something and going down and up with your wrist, super slow. So it'll be stuff like that. You can even try doing that as well with a weight. Maybe like a cable or something, doing that. That's what they would do in like PT.
Okay.
So we'll feel in the external rotators. Got some clumpiness in here especially. So we'll pin the spot, bring the arm forward. Yeah, it's tight. So all these spots are connected. Pretty simple patterns. And when it's a weird pattern, that's when I'll start to ask more questions. But this seems pretty straightforward. So I'll just get in the shoulder blade a little. So is the levator in there. You get headaches at all?
Yeah.
You do?
Yeah.
A lot?
Yeah.
Like how often?
I think like 4 times a week.
Wow.
Yeah.
Where do you usually feel it?
I think like behind my head. Like kind of like right here.
Okay. Sub-occipital headaches. Not usually coming from the traps, usually coming from the upper neck. So we'll check that out. And I feel 2 nice little jelly beans in here. We'll try to just wring them out. Got a really good one on the right side here.
Mm-hmm.
Feel that?
Yeah.
How long have you been getting the headaches for?
I think like it's been a couple of months now.
4 times a week's a lot, man.
Yeah. So I don't know if it was like just like dehydration or something else.
Well, I treat a lot of headaches, and usually the first thing I recommend is getting the water intake back to normal if you can. That's usually the first step into figuring out where it's coming from. And if that doesn't really do anything, then yeah, it's probably coming from down the chain or in your blood, something like that. So we got a really good one at like T3. I'm gonna create some space in his spine. Lift, down, lift, down. Good.
Oh.
And we'll hit all these A to P. Does it feel good when I pull down?
Yeah.
Yeah. Sacrum's very connected to the occiput, so there is a chance that just releasing a lot of tension in here can free up the skull as well. So we'll do 2 sacrum adjustments there. Okay, so just a lot of tension in his occiput. We'll try to lift here. Just let your head fall. Good. Both sides here. Good.
Ooh.
Little jaw occiput complex.
Yeah.
Good stuff. Those are gnarly ones. We got them out of the way though. Okay. Give yourself a hug. Lift your head up. And just keep your chin tucked down for me. Good. I'm gonna pick you up. Don't help me at all. Oh, wow. Ooh. Love that. Whole left leg feels a little shrunk up. Not shorter, just a little shrunk up. So we'll give it a little pull. Didn't change too much. Check the ankle. That helped. But there's probably just more work I need to do in his hip flexor, glute area, probably the low back to try to even that out. I know a lot of my YouTube watchers, a little older, stiff men. He's a lot easier to work on because he's younger. He didn't wait 50 years before he got adjusted. I know you're watching. Sacrum here. Damn. So the fact that everything's cracking really easily, it means that the fluid around your bones is very hydrated, healthy, clean, no arthritis. Again, it helps that you're young. A lot of that is age related or genetic related, but also diet, lifestyle, you know, you're active, so it's a really good thing. I can get a lot more out of a treatment with you. Same thing, right on the sacrum again. Not much there. Just give that a little pull. So when I pull up, does it feel good?
Yeah.
Yeah. Okay. Good candidate. Let's go to the other table. So a lot of tension right under the skull, students. Slide down just like an inch right there. So where I'm going to set it up is going to be right under the skull rather than mid-neck or lower neck. I'm just going to try to create more room between his skull and the rest of his neck. More room, you know, more room for good things. Lift your head up, down, up again. It's kind of a long neck too. Okay. So I'm going to stretch you out first, make sure it feels good, just get you used to it. Yeah, right there. Is that okay on the cheeks?
Yeah.
Okay. Let me know when it starts to feel like a nice stretch in your neck.
Yeah. Oh.
Nice.
Oh.
Lift down. Where'd you feel that?
Everywhere.
Ain't that nice? I know some people who have been treated by me who are watching this wish they could say that.
Wow.
And if you came in when you were young like this, you know, maybe it'd be easier. Some things to think about. This is too heavy. This is 10 pounds. But she had me doing something like this, maybe like 3 pounds or something, and just going slow down as far as I can. Literally all the way till you can curl it all the way down. And then you pick it back up with the other hand. You never want to like do that again. So we're training this to decelerate and to lengthen. So yeah, sometimes the coordination in your elbow isn't there because of, you know, other stuff going on. That's why the brace will help, because it like just stabilizes it, creates stability, coordination. So yeah, good job.
Thank you.
Yeah. Hey everyone, if you made it this far, I just want to say thank you for watching our weekly video. And if you have any questions about chiropractic care in general, just leave a comment, let me know. Or if you have any video ideas you want me to do, drop it down in the comments. If you made it this far and you're not subscribed, come on, it's free. Can you please just click it? It really helps. Have a good day.